Hello, ladies. Hello, everybody. Today, we're going to talk about pelvic floor dysfunction in women. Okay, what it is, and then some things that can actually really help. So, here, if you leak when you sneeze, laugh, exercise, if you're jumping at the trampoline park with your kids and you have to wear a pad, maybe you feel pelvic pressure, urgency, discomfort, painful sex. Maybe you're experiencing something called pelvic floor dysfunction. It's incredibly common, especially after pregnancy and during midlife, but it can happen to us actually even in our 20s, late 20s and 30s. But most women don't even really know or even, we're even really taught what pelvic floor dysfunction is, or a lot of us aren't even taught what the heck the pelvic floor is to begin with. So today I want to explain what is the pelvic floor, what is pelvic floor dysfunction, and then what are the things that we can do. Because this really actually, ladies, impacts our life from our sexual health to our core health to our metabolic health. Pelvic floor dysfunction is huge, okay, in the space of the quality of life that we live. Okay, so we're going to talk about that today. What is pelvic floor dysfunction? So, pelvic floor dysfunction happens when the muscles that support the pelvis, okay, when those muscles are not working properly. The pelvic floor is set up as a group of muscles that sits at the base of the pelvis, just like this, kind of more like forward. Think of it as a supportive hammock, and it holds up some really important things: the bladder, the uterus, the bowel, right? So we want those things to be held up, right? These muscles play several roles. They help control urination and bowel movements. They stabilize the core. They support our pelvic organs, and they actually contribute to sexual function. So when they become weak, overstretched, or poorly coordinated, and sometimes even spasming, we can get symptoms like leaking urine when we're coughing, exercising, jumping on the trampoline, pelvic pressure, pain with intercourse, reduced sexual sensation, reduced orgasms, difficulty fully emptying the bladder. These are no joke symptoms, right? Like, who wants those? So, there are several reasons why pelvic floor dysfunction actually develops: pregnancy, childbirth, but even really elite athletes that are doing a lot of things under pressure. These can stretch and weaken the pelvic core. Then we add in things like perimenopause and menopause, where we now are having hormonal changes that also affect the strength and elasticity of the pelvic tissue, and we can have bigger issues. We get chronic pressure from heavy lifting, impact exercise, constipation. Most women don't know that constipation throughout your life can lead to pelvic floor dysfunction, persistent coughing, or straining with these muscles. Okay. Pelvic floor muscles are unlike, they're not unlike any other group of muscles. They can weaken over time if they're not exercised or strengthened. And actually, sometimes they're actually too tight, right? They're in that titany, right? So the other piece of this is the hormonal connection. So estrogen plays a major role in maintaining the health of the vaginal and urinary tissues. We know that, right? Tried, true. We know that vaginal estrogen for everybody trying to make it over the counter, right? This is how it should be. So as estrogen levels decline during perimenopause and menopause, the tissues around the vagina, the urethra, they become thinner, drier, less supportive. Genitourinary syndrome of menopause inserted right there, right? So guess what? That can be a problem. Once treatment, one treatment there we know, and we talk about it all the time, we just said, is local vaginal therapy can help restore tissue health and improve support around the bladder and urethra. And actually, we even see that some women postpartum, if they're breastfeeding, because that is an estrogen depleting era, need vaginal estrogen while they're breastfeeding to help restore that tissue, the health of that tissue. Okay. So because that medication, right, that the estrogen is local, it can help support that vaginal tissue. So how do we fix? We have this dysfunction. What do we do? Strengthening the pelvic floor, in addition to improving tissue health. So as we see, everything in longevity, health span is multifactorial, right? It's not like, okay, just go do a million Kegels, you'll be fine, right? You see, we have to restore the tissue, the hormones back to the tissue, so vaginal estrogen, and then we need to figure out what's going on with the pelvic floor. And how can we figure that out, right? So pelvic floor therapy is often one of the best treatments. A pelvic floor physical therapist is trained in pelvic health. They can go in and even do an intravaginal exam and determine what type of issue that you're having. So, like we said, you could be having too much contraction. The muscles are contracting like this. Well, then Kegels aren't going to do you any good, right? Strengthen, trying to tighten that muscle more is not going to help. There, they will work with you. You'll do exercises, diaphragmatic breathing, things like that, that are going to help from that modality. Okay, that will help you relax those pelvic floor muscles because that's what needs to happen in that regard. If they notice that it's loose or weak, your pelvic floor is weak, the muscles are kind of stretched out and weak, then they can do some pelvic floor therapy. Kegels, which everybody knows Kegels, right? Everybody knows that. Um, those are meant to activate that pelvic floor. It's kind of like doing a squat, right? Or a bicep curl. But insert better technology that we now have, and we have a device that's called MSALA. It uses electromagnetic stimulation to trigger very strong pelvic contractions. So in a single session, fully clothed, right, the pelvic floor muscles contract thousands of times, helping strengthen and retain those muscles. And the treatment's completely non-invasive. So it is an amazing addition. Now, this wouldn't exactly be for somebody who's had that tight pelvic floor problem. So it's very important that we understand what type of pelvic floor dysfunction that we have, because all treatments aren't created equal. If you're tight and you're going to do 100, 1,000 Kegels, that's not the answer. We got to work on different things. Same thing with using MSALA. But MSALA is a really cool tool because it's 30 minutes on this amazing device. You sit there fully clothed, decrease in urinary incontinence, increases in your muscle mass and tone. OMG, right? Like this is for the right person, this can be unbelievable. And believe this or not, just like we said, improving your pelvic floor strength and the tissue, right? We're doing multiple things together, improves bladder control, exercise confidence, sexual health, and your overall quality of life. All right. It's important. It's an important part of women's health that deserves a lot more attention than it gets, to be honest with you. So if you're experiencing symptoms of pelvic floor dysfunction, let's find out what's going on. Number one, you should have an evaluation from a hormonal perspective. Are you experiencing gentle urinary syndrome or menopause? Are you a breastfeeding mom and maybe you need some vaginal estrogen? We got to supply back that tissue what it's missing, and then we have to support the muscle. So either we got to build up the weak muscle or we got to take a muscle that's under tension and start to decline. Okay. Building up that weak muscle, we can do Kegels, pelvic floor therapy, we can do MSALA, right? We can do both together and augment treatment, all with our big combo, right, of treatments that is going to be most effective for us. And then if we're working with a pelvic floor therapist, if tightness is our problem, to do that breathing, the diaphragmatic breathing, all of those types of things to kind of relax that pelvic floor. Okay. So pelvic floor dysfunction is a big part in women's health. And the reason is it affects your life and your lifestyle. And when we talk about sexual health, when we talk about vaginal health, it is multifactorial, right? It is not just do Kegels. It is not just have vaginal estrogen, although we love that. That's not just the answer, right? We need all of these things in combination that fits right for us. All right. So if you're interested in learning more about pelvic floor health or what options are available to you, like MSALA, please reach out to us. We are happy to give you a consult if you are in a state that we practice in. If not, you can look one up in your area. You can look up pelvic floor therapists in your area, and you can talk to your doctor about it. Okay. Pelvic floor health. It is the key to longevity. It is the key to health span. It is the key to us feeling like we should in midlife or before, right? Having babies, wherever it is very important for us ladies. Okay? Okay? So don't just go do your Kegels. Understand what's happening so we can get you the right treatment. Okay? Or the right combo of treatments. Until next time, stay well.